Okay, can everyone see that? Okay, great. So my name is Yuri. Do we have everyone here? Oh, hold on one second. Sorry, do we start or do we wait for announcement?
Go for it.
All right, sounds good. So my name is Yuri. I'm an intern at Lurie Children's at Northwestern, and I've been asked to facilitate this presentation. So I will be going through the slides, and then I'll be introducing each of the programs. Okay, so in this room, we have 6 programs. We have our program, Northwestern University, Lurie Children's. We also have University of Louisville, Case Western, Helen, DeVos, Michigan State, Akron, and University of Oklahoma, Tulsa. Okay, so each program is going to get about 5 minutes to present their infographic, and then hope you guys enjoy. All right, and then these are the residents associated with each of the programs. All right. So our chief residents will be talking about Lurie.
Hi, Yuri. Thanks so much for having us. Hi, everyone else. I'm Sharon Unti. I'm the residency program director at Lurie Children's Northwestern, and I'm excited because tonight all 3 of our chief residents are here also. I'll let them each introduce themselves.
Hi, everyone. I'm Lucas. Nice to meet you.
Hi, I'm Leanne. Nice to meet you.
And I'm Dan.
Okay, now you've met like a little bit of the team. We have a few minutes to share our perspective on what's exciting about our program, and we hope if you're interested that you'll reach out to us and get more information. But my perspective as the program director, you might hear this often given that this is the Midwest group. The greatest strength of our residency program is definitely the people in our program, and having said that, the greatest strength, I'm very biased, are our pediatric residents. Our residents are amazing, and we have such a nice, as was stated earlier, sort of family vibe here between the residents, but with the residents and the faculty. It's a big academic residency training program with the opportunity to have training in all the subspecialties, nicely juxtaposed to great general pediatric community-based medicine training because we're in Chicago. So we're lucky enough to have a very diverse patient population, and we're maybe super lucky that we can maximize our advocacy opportunities because if you didn't know this, the national headquarters of the American Academy of Pediatrics is located in a suburb of Chicago. So we take full advantage of that. I think I'll say one more thing and then let our chief residents share their perspective. I think another strength of our residency program is the goal to train you as the most amazing general pediatrician you could ever possibly be. And then you get to choose whatever you want to do. And in this program, each year, about half of our residents go on to fellowship training, fellowships of all different kinds. The other half go on to primary care general pediatrics. For some of those people, that's outpatient general pediatrics in a practice or clinic setting. And for the other half-ish of that group, that's inpatient general pediatrics that you would think of like hospital-based medicine. So just to be cognizant of the time, I think I'll stop and let our chief residents share their thoughts.
Thanks so much, Sharon. We have a lot of reasons that we love Lurie. A lot of them are outlined here on our infographic. One of the things I want to point out is our diverse patient population that we have here. I know Dr. Mather mentioned that there's a lot of different patients that you'll see all over the Midwest. But I think one of the misconceptions about our program sometimes is that because we are in downtown Chicago, we don't see a very wide and diverse variety of patients. But you can see from these graphs that we have here, that sort of sea foam or light green color On the left is actually the Hispanic Latino population that we serve. And then on the right side, that little bit darker, other seafoam green color, is actually the number of patients that we see with public insurance. So we actually see a very wide variety of patients here. I think one of the things that I love the most about Lurie is the people. Like Sharon mentioned, we have a great community here. It's very supportive and friendly, with a lot of close relationships between the residents and the staff, as well as the residents and the attendings. All the residents love each other and really see each other as one big family. I'll turn it over to my co-chiefs here for their reasons why they love Lurie as well.
Yeah, so again, I'm Leah. I think I've obviously loved Lurie for all the reasons that were stated here, but one of the things that I have really appreciated a lot in the past few years is the faculty mentorship here. Faculty are extremely easy to get a hold of. In fact, it was just like last week, I was on the phone with one of our premier researchers. He has like written all these amazing articles on the podcast Peds Rep. You would think he would be very intimidating, but we ended up on this hour-long conversation about where my life should go and what trajectory I should take it. And that's just one example of how devoted our faculty are to the residents and to like mentorship and career development. And so that's been something I really appreciated here.
And hi everyone, I'm Dan again. I totally agree with Lucas and Leah. But one of the things that I really love about our program is the dedication to education. We have 2 one-hour educational conferences built into our daily schedule Monday through Friday. So from 8 a.m. to 9 a.m. and then 12 p.m. to 1 p.m. So we have report every single day of the week where we have residents present cases, and then we have didactic lectures and grand rounds the other days of the week. And I think when you come to our morning report, you just get a really good sense of how passionate everyone is for learning, and the engagement between the interns, the senior residents, the fellows and faculty was really unmatched when I was going through my interview process. And so that is probably one of the things that I love most about Lurie.
Awesome, thank you guys. So we'll be around for any questions later on. Next up, we have University of Louisville. Take it away.
Good evening, everyone. My name is Sarah Moulter. I'm the Residency Program Director at the University of Louisville and Norton Children's Hospital. I am joined this evening by 2 of my residents, Addie Dodson and Kawanta Barlow. If you guys want to quickly say hello to the group before I move on.
Hey guys, I'm Addie, one of the 3rd years and one of the soon-to-be chiefs, so very excited to potentially meet and talk with you guys tonight.
Hey, I'm Kawanta, one of the interns, so fresh out of the gate from it. I am looking forward to talking to everyone.
All right, thanks guys. Well, I'll just hit a few highlights of our program. We fall right on the border between a medium and large residency program. We have 24 categorical peds residents per year, 3 child neurology residents per year, and 5 med peds residents per year. Our residents spend the majority of their time at Norton Children's Hospital, which is our primary clinical site. It is the only freestanding children's hospital in the state of Kentucky. You also will do rotations at University of Louisville Hospital, as well as the Wendy Novak Center for Children's Health, which is primarily our outpatient, both general pediatrics and subspecialty clinic site. Probably one of the biggest highlights of our program is our advocacy program. It's called PUSH. It stands for Pediatricians Urging Safety and Health. It's a completely resident-run, resident-driven advocacy program. They cover legislative advocacy and do things like go to our state capitol advocating for bills and other legislative action as it relates to children's health, but really get most excited about community advocacy in non-COVID times, really able to get out and participate with a lot of different community organizations, do things like health fairs. They helped build a community garden, do a lot of work with different after-school programs, which are all really meaningful pieces of their training. We also have special distinction tracks for residents who have special interests beyond just taking care of kids. We have distinction tracks in global health and research and advocacy, and we're hoping to go live with a medical education distinction track in 2021. We also have international rotations in Tamale, Ghana, and Quito, Ecuador. We also do X+Y scheduling, which is something we started doing about a year ago, which is a somewhat unique approach to scheduling residents for their outpatient clinics, really trying to optimize time in clinic as well as optimize clinical rotations. And then Louisville is a really great place to live. We've talked a lot about the affordability of the Midwest, and Louisville is, like our program, kind of on the border between a medium and large city, with a lot of things to do, lots of unique neighborhoods and cool restaurants. And so with that, I'll turn it over to Addie and Kawanta to maybe say a few things about some of their favorite things about the program and about Louisville.
Yeah, I actually took over the resident Instagram kind of this week. So really was a nice little focus on bringing me back to reasons why I decided to come here. But I really think, as most of you guys will hear, that the Midwest is that the people are truly the best part about residency programs. Some of my best friends and pretty much like family are going to be from this program and time here. But I know this is all pre-COVID, but I've had like no issues with finding fun things to do with the residents or my other family, like here in the city. And it's just truly a great, diverse city to live in and work in and serve in too. So.
And then, sorry, one of my favorite things about Louisville and the reason that I chose this program was just on my interview day, the vibe was really good. I really enjoyed talking to everyone. Everyone seemed super nice and super open. Even now, my class, even though we haven't been able to hang out as much because, COVID, we really have a great bond already. Like even right now, I'm on newborn. And even though we don't all have to leave at the same time, everybody's like, do you need help? How can I help you? Do you want me to go and check on this for you? Just really like helping each other out. Also, the staff is super supportive. Everyone is there to answer questions whenever you have them. Everyone challenges you and helps you to learn and become a better physician. So it's a great place to be.
Thanks, guys.
Sorry. All right. Thank you. We're moving on to our next program. Okay, Case Western, take it away.
Hi, can you guys hear me? Hi, I'm Philip Fergassi. I am the program director for Metro Health, which is in Cleveland, and we're affiliated with Case Western Reserve. And I can't see where I am on the thing, so I hope you can see my face. I am new to this. I'm one of the probably newest program directors. I don't know any of the people here. I just started doing this a year ago, but I have been at Metro Health for 27 years. The reason that I love Metro Health and Case Western is, we are the community hospital. So we have always been the ones who take care of the underserved population. So I came to Metro because of the mission, and the mission has always been that we take care of every patient regardless of their ability to pay. And that is the reason that I've stayed here for 27 years. And I think it's kind of great in the sense of, we talked about academic programs versus community programs, and we're also in the middle range. We have 8 categorical residents a year, so 24 peds residents. And then we have 6 med peds residents a year categorical, which gives us 24 med peds residents. So it's a decent sized program, but we all still feel like a family. The first thing I want to talk about with our program is the wellness opportunities. I'm really into wellness. I kind of forced all the residents to go on a bike ride with me last weekend because I'm into biking. And it was absolutely beautiful because we got there right when the rain quit. And I got to talk to one of the residents who's from Ecuador, and we had a resident from Brazil. And it was just amazing for me to get to know these wonderful young people. I love our residents. Our residents are absolutely amazing. We also do something called Balance sessions, where we actually have interpersonal skills taught, and to kind of spend some time working at the doctor-patient relationships more than just the academic portion of the program. One of the coolest things about our program, though, which is pretty new, is we have a whole pediatric psychology integration program. So we have, and I don't know the number, I apologize, psychology interns that are actually in the clinic during continuity clinic and during our RAP clinic, which is our rapid access pediatric clinic. So anytime you have a patient who has ADHD or has suffered from some major trauma or is depressed, we immediately can grab one of the psychology residents, and during our session, they will come in and either do what's called a warm handoff, where they kind of introduce themselves, make sure that there's no specific concerns. And if there are concerns, then they will spend some time doing actually some psychologic counseling right then and there. The other thing that we have is we have a very large Hispanic community. So we have a large pediatric Hispanic clinic that is run by one of our Hispanic physicians. And we have a Pride clinic, which is run, we have a transgender and a gay LGBTQ clinic. The transgender clinic is run by our pediatric endocrinologist. And I was just starting a global health curriculum. We have the curriculum, but guess what? There was a pandemic and we can't go anywhere. So we have the curriculum in place, and I'm hoping for the next few years we'll be able to start actually going to other programs and do some work with them. I have with me not just Paula, but I hope I have Mehul and Kelsey, two more of our residents there. If you guys are on, can you say a little something?
Yeah. Hi.
Hi, Paula.
I don't know how. Hi, I'm Paula. I'm a third year pediatric resident, Metro. I don't want to stay to prolong this too much, but I love Metro Health, and I'm gonna repeat everybody else, but the people are great, and everybody is very friendly. So everybody welcomes you to Metro Health, and also Cleveland is a very nice city to live, and I'm looking for a job in Cleveland, so I really like the city. So please come to our program.
And Mehul and are either one of you in there? Mehul and Kelsey may not have been able to get in.
Oh, hi, Dr. Fagassi.
Hi, Mehul.
Hello, everybody. My name is Mehul. I'm one of the second-year pediatric residents here at Case Western Metro Health. So I moved in from India, and Cleveland's my first home here in the U.S., and the transition has been great. So just one of the other things that I would like to highlight is that the balance between the community and the university affiliation with Case Western, that we are primarily a community hospital, but at the same time, if we are interested in the subspecialty track, we have opportunities to rotate at the various other sites, which is Cleveland Clinic and Akron Children's Hospital and the Rainbow Babies and Children's Hospital. From my perspective, I'm interested in applying to pediatric hematology oncology. So I have had a great experience with our inpatient service to do my inpatient rotations at the clinic, and also being able to do elective rotations at the other bigger children's hospital. Having said that, I love coming back home to Metro Health because that's where my heart lies. So as I would say it again, that having spent a year here, I definitely think that I would do this again. If I had to choose to do residency again, I would do it at Metro Health. So that's all I have to say. Thank you.
All right.
Thank you, Mehul. And
I have to move on to the next group. Is that okay?
Oh, I just wanted to say I was told to bring up that we have a foster care clinic too, which is really cool. All the foster care children who are need physicals will come to our program too, and I was told to mention that too. Thank you, guys. Have a great day.
All right, thank you. All right, next up is Helen DeVos. Dr. Sipalinga, are you there?
Hi. Yes.
We have a little trouble hearing you. I think you might be muted.
Thank you. So I'm coming to you guys from Bear Dunes, which is explaining some of my connection if we're having a little bit of trouble. So my name is
I think we lost the program director for Helen DeVos. Is anyone from Helen DeVos here that can talk?
Hi. Can you guys hear me?
Yes, we can hear you now.
Okay, I'm sorry. If I cut out again, just go on. If you guys don't. So anyways, my name's Kira. I'm from Helen DeVos Peds in Grand Rapids, Michigan. It's on the west side of Michigan. And I was telling you that northern Michigan near Sleeping Bear. So DeVos Peds with Michigan State University College of Human Medicine, and we are a free children's hospital in Grand Rapids. So if you don't know much about Grand Rapids, we are about a little less than 1 million metro population, half hours away from Chicago. West, you really have a rural, urban, refugee, Medicaid, private insurance. We have a very large catchment area, which is what makes our hospital a great opportunity for you all to train with a wide variety of diagnoses. What I really like about our program is, just like all the other great Midwest programs, we always say it's the people, and we love living in the Midwest, a place where things are affordable, and you can really access a lot of culture, yet get to nature pretty quickly. So very quickly, since I took some time with my connection, we have 20 peds residents per year. We are just starting a child neurology residency this upcoming year. So if you're interested in child neuro, please apply. We will have 2 slots for that. Been around for the past 26 years, and our growth right now is in fellowships. So we have 6 fellowships. We're expanding up to about 10 to 15 in the next couple of years. So what that gets you, I think, in this size city is an opportunity to be in a setting where really the peds and residents and the attendings work very close on that first name basis, but also we have access to the quaternary and tertiary care to provide access for the region. Some of the highlights that we're looking at are our tracks. We've got 5 programs, and about 50 to 60% of our residents go into fellowships. It's hard to know how to class peds hospitalists at this point. Are they generalists or are they specialists? So that's kind of that 10% in between. But this year's class will be 60% specialties, and a lot of the class stays and provides primary care right here in West Michigan. Within tracks, we have special scholar tracks. One of our scholar tracks is a lifestyle medicine track. We have a big lifestyle medicine program here at Spectrum. We have a global medicine scholar. Again, just like everybody else has said, we haven't been able to offer away rotations this year, but we'll back to it. And we also have a med scholar position. Our interns begin every year with intern immersion advocacy. So their first block or their second block will be all in clinic and out in the community. And that helps you all get to understand Grand Rapids and understand where you're practicing. So thanks you guys for giving me your time. Sorry for the spotty internet connection. Happy to answer other questions. I'm really glad you guys are interested in the Midwest. It really is a great place to train.
Thank you so much. All right, moving on to the next. All right, Akron, take it away.
Hi, my name is Sabrina Benzayan, and I'm one of the APDs at Akron Children's Hospital, and I'm standing in for our program director, Maria Raimondo, who couldn't be on the webinar tonight, so sorry to do a bait and switch on you, but that's where we're at. So we are one of the hybrid programs where we're community-based but university affiliated, and I'm excited to get a chance to share with you a little bit about our program in our hospital, which many in the area consider us kind of a hidden gem. We are a freestanding tertiary care hospital. We serve patients from a 26-county area, which actually makes us the largest pediatric provider in Northeast Ohio. But we're happy to share with some of our fellow programs in the area. So we have Rainbow nearby and Metro nearby. And we have all the major subspecialties, just like a lot of the other hospitals, but we don't have that many fellows, and that's kind of nice because then our residents get to work one-on-one with the attendings. So we also do serve a diverse group. I'm a California transplant, so I was a little surprised actually how diverse Akron, Ohio was. We have quite a few Amish patients here, as well as refugee population. And I think one of the strengths of our program, kind of written there on the highlights, is our continuity clinic. So we have each resident paired with a single preceptor out in one of our many community offices, and those are either rural or urban or suburban. For the last couple of years, we've been doing a exposure to the ICU. So your first year, you actually do a 2-week NICU and then 2 weeks in the PICU. Like many other people that have mentioned, Midwest is best. Again, I've been here now for 15 years. I've been in medical education for 7, and I am surprised at how interesting and how many things there are to do in the Akron area. We have great metro parks. Cleveland is not too far away, so we've got kind of the major concerts and ballet and theater and all that good stuff. We also do have some of those different tracks that some of the other programs offer, such as an advocacy track as well as a leadership track. We are also, like Louisville, we kind of border on medium to large. We have 21 residents per year. I think over 60 total is considered large, so we have 63. And we are the 9th largest children's hospital in the US, so we see a lot of patients, and that gives our residents great experience. We do have one of our chief residents on the call, and we have 2 of our rising chiefs on the call. So I'm gonna let them say a little bit if they want. So Laura Wingert's our chief, and then Nicole and Aaron also. So I'll let them say a few words.
Hi guys, I'm Laura. Like Dr. Benzion said, I'm one of the current chief residents, and I love it here at Akron Children's. I, volunteer to essentially stay on for a 4th year, and I think some of the best things Dr. Benzion already highlighted. The people, I think we continue to say that in the Midwest, and it continues to be true here at Akron Children's, but I think the training you get here is second to none. I'm applying for an ICU fellowship, and I feel super prepared, and people are very impressed by our experiences, especially the hands-on experiences we get, because we don't have as many fellows procedure-wise and taking care of cardiac patients that otherwise at other places people do not have those same experiences with. So I think you're not only prepared to be a general pediatrician, which is very important, but you're also prepared to head into those fellowships and subspecialty areas that you're interested in regardless afterwards with our individualized curriculums. So we're happy to answer more questions about that, but I will throw it to our 2 rising chiefs.
Hi guys, my name is Erin. I'm one of the 3rd years in I think my favorite thing about the program is clinic, like Dr. Benzion was talking about. I am a primary care person, so I really love that I get to immerse myself in the clinic of my choice with the population that I love most. There's also opportunities to rotate through clinics that aren't your home clinic, so you can see differences in the different kinds of patient populations and the problems that you have. And the other favorite thing I love about the program, which I know everybody sees people, it's such a family atmosphere, so much so that when we first started residency, we made a spreadsheet full of each other's favorite comfort snacks. So if you know that somebody's having a really tough day, people just show up with your comfort snack in order to help each other through it. And it's just that wonderful kind of atmosphere. And then I'll let Nicole talk.
We're actually out of time for you guys. Is that okay? Did you want to say a few words and then move on? Okay.
Hi, I'm Nicole. I just echo everything that Erin said.
All right, great. Thank you, guys. And then last but not least, we have University of Oklahoma, Tulsa.
Good evening. You guys had a chance to meet me when I chatted just briefly to introduce everything. So I just want to introduce the people with us, and then I'm going to turn things over to our Associate Program Director. First, we have our Program Coordinator here. Jenna, are you there?
Yeah, I'm here. Hi, Jenna Tao, the coordinator.
And then we have our Chief Resident, Jake Kaminsky.
Hi, everybody.
And also we have a third-year resident, Anna Kaler.
Hey, everybody. I'm Anna.
And both of them we are able to get from out of state to come join us, and so we'd love to have everybody else consider Tulsa, Oklahoma. Our Associate Program Director, Dr. Escala, has come to us from the Dominican Republic, and I'm going to turn things over to her to let her give you the program highlights.
Hi, good night, everybody, and welcome. So I'll start by letting you guys know, so I am from the Dominican Republic, and so the first question I think I got asked the first 2 years that I've been here, which I'm now coming into my 7th year here in Tulsa, was how did I end up here? And that's basically what I'm going to share with you guys today. But when I interviewed here, I love the program. It's a small program. It's 8 residents per class, so it's very family oriented. Everybody knows each other. I work in the outpatient clinic, and our outpatient clinic has a very different sort of layout. So the residents get assigned to a color team for 3 years, and the patients are actually under the residents' names, so they are able to develop continuity care throughout the 3 years also. And then in our hospital, basically it's the only pediatric children's hospital in Eastern Oklahoma. And our clinic, our outpatient clinic, is also the largest clinic in the state that serves Sooner Care Medicaid patients. So that makes it very interesting. I was very positively surprised because our Hispanic population here is very, very big. And so there can be an afternoon that basically I only speak Spanish to the patients, which is great. And because we are a small program, we only have 1 fellowship. But yet a lot of the, if you see here on the statistics, a lot of our residents that want to go into fellowships get into fellowships. So about 40% of them go into fellowships, and the remainder then stay in general peds. And that could be outpatient or hospital care. And so I'm going to let Jake and Anna add anything else. But like I said, I've been here now 7 years, and I don't have beaches, I don't have sand, but I have beautiful lakes or rivers that I've enjoyed too. And so anyhow, it's been great for my family and for us to live here in Tulsa, and I hope you guys can come and join us too.
Hi, everybody. I'm Jake Kaminsky. I'm the 4th-year chief for pediatrics program at OU Tulsa, and I'm originally from Houston, Texas. And so being my first time living abroad, as you may say. But what brought me here to Tulsa, I actually interviewed at 18 different places before I decided on coming to OU Tulsa. And essentially it was because of the people and the place. And that's because when I was here, I clicked with the residents, I clicked with the faculty, everything just felt right. And I wanted to go to a place where I would feel supported throughout this wonderful struggle that is residency. And Tulsa itself is a fantastic town to do residency in. It's really a town where you can make of it what you want. If you want a big town feel, we can go to some really great restaurants, see Bruno Mars in concert, go to a ball game, asterisk COVID. Then you absolutely can do that. If you're an introvert and want to live in a smaller town around Tulsa and get the small town feel, which a lot of our residents did, doesn't mean that they were introverted, but they could live in a smaller town and come into Tulsa very easily. So it's really what you make of it. There was no shortage of diversity of patients or diagnoses for that matter. I came across some very interesting things in my time here. And the staff were just super supportive. I can't tell you how many times Dr. Mather, when somebody was sick and couldn't make their shift, be like, well, do you need me to come in? Like, what can I do to come in? He was just so ready to jump in. So it's definitely a place where you feel supported, you feel prepared for whatever you want to do, fellowship or primary care. It's really a great place to be.
So I'll just tag on and say I am from the Midwest. I'm from Michigan. So I was already used to Midwestern friendliness and hospitality. But when I came to Tulsa to interview, I was just blown away by how welcoming everyone was. I really like the fact that our program is so small. I'm sure in the larger programs you get to know everyone as well, but here we know everyone like inside and out. Like we have really good relationships with the classes above and below us. And kind of on the other side of things, I really love that we get to work one-on-one with all of our specialists. Any rotation that you do, whether it's endocrinology or peds surgery or anesthesia, you are the person who is doing those things because we only have the one fellowship in child abuse. Although in child abuse, you don't have any interference from the fellows. They're just super helpful and welcoming. I just really enjoyed the one-on-one aspect that we have with all of our specialists, and I love Tulsa.
All right, awesome. Any last words from Tulsa?
Yes, thanks everybody, and thank Tulsa. We'd love to answer any questions you might have.
All right, awesome. Well, thank you, everyone. So we're gonna move on to the Q&A session for the little time we have left. So residents, if you don't mind going to the document and putting your names for some of the questions, and I'll call off the names in the question, and then if you can read that off and then kind of address it to the whole group, that'd be great. Our wonderful rising chief, Amir, has claimed the first question. So Amir, would you mind addressing it to the whole group?
Sure. Hey guys, my name's Amir. I'm one of the third-year residents at Lurie Children's. I'm going to be a chief next year, as Yuri said. Looks like the first question we have is, I would love to hear how your pediatric residency program helps residents who are undecided about their career path within pediatrics. What does mentorship and specialty exploration look like at your program? So Yuri, do I answer this from, or do someone else answer?
Yeah, you can answer, and then kind of bring it up to like other programs they can
Sure.
answer as well.
So at least in Lurie, I think we have a pretty good job of career mentorship and specialty exploration. From the mentorship aspect, as an intern, you are matched with a assistant program director, or Sharon, the program director who you already met. You are matched with a chief as a mentor, and you are also matched with a faculty mentor. The faculty mentors are usually matched up with whatever career interests you have outlined as an applicant. So for example, when I was applying, I knew I was interested in either cardiology or ICU medicine, and I was matched with one of our cardiologists, Mike Carr. And he's been so helpful for me just going forward. I've been able to find good research mentorship through him and just through the division as a whole, because they're very receptive to people who want to do research. And he's also helped guide the way I start thinking about applying for fellowship. So that's been really great. As far as the specialty exploration goes, we, like Sharon and our chiefs were mentioning, we have a lot of different wards in our hospital. We have a lot of different services in our hospital. So as a resident, you pretty much rotate through every single subspecialty, whether it's kidney, infectious disease, neurology, cardiology. Pretty much every one of the rotations you'll rotate through and do inpatient medicine for them. And then you will also have opportunities to do consult medicine for them as well on your electives, or do outpatient rotations with them as well. We have fellows for most of our specialties as well, which is nice because you're able to chat with them and kind of gain their perspective on what it's like to go into that fellowship, and just have a different perspective than just seeing what the attending lifestyle is, as well as the fellowship. That's mostly it. I don't know if anyone else wants to talk about their experience as well.
One thing that we do in Louisville is we have career exploration afternoons that are integrated into your outpatient rotations when you're rotating on the Y blocks in your X+Y schedule. So you have an afternoon when you're hooked up with a faculty member in the career that you have an interest in, and they'll talk to you a little bit about how they came to their own career decisions, some basic things about their what their life is like in their specialty, and they also might show you things that you might not see on a standard clinical rotation. So for example, if you're interested in NICU, they might take you to a community NICU site that they cover, which is a little bit different than our larger urban NICU. We've had residents go on all kinds of field trips with different faculty just to see all the different aspects of careers in in their field.
Speaking for OU Tulsa, when you arrive, you are assigned a faculty mentor to be your mentor throughout your residency. But also, one thing is that there's the only fellowship in town being child abuse pediatrics, means that if you need to contact a subspecialist, you don't have to go through a fellow in order to get there. So a lot of times we may have the subspecialist's personal cell phone numbers in our own cell phones, and can pick them, and as you talk with them, you can develop a relationship with them, and you can pick up mentors along the way, and get plenty of exposure to diagnoses and such to gain further insight into whether it's something you would want to go into yourself or not.
Hi, this is Phil Fergassi at Metro. One of the things, because we have such a small program, I basically meet with all of the interns 2 or 3 times their first year. And we do not assign you a mentor initially. You'll be working with me and one of my 2 APDs, and you kind of get a little feel your first 6 months of what you're interested in. And then you're allowed to pick who you like. And pretty much all the subspecialists, ambulatory peds, and ICU physicians are willing to mentor, and they will be happy to help you kind of figure out what you want to do with your life.
Great, sounds good. Thank you so much for those who answered. So we have another question, which none of the residents have claimed yet, but I can just kind of put it out to all the programs, is what traits would you expect IMG candidates, so international medical graduate candidates, to portray to be considered for the program? Did anyone have any input on that? Lucas or Dan or Leah, my chief residents, do you guys have anything on that? If anyone wanted to kind of answer the question.
Yeah, so we absolutely look at all the applications that come our way, including from international residents. We have some international residents in our program right now, and so it's absolutely not a barrier for us in terms of getting interviews, coming here for residency. It's something that we love talking to people about and love hearing about, and we absolutely welcome at our program.
And I will say at Metro, we also have a large portion of international graduates, about half of our residents. And being a brand new program director, I constantly had to pull up my map and figure out where everybody was from. And it's been really great to have so many diverse and interesting people in our program. So we look at our international applicants the same way as we do our national graduates, trying to figure out who's a good fit for our program.
And I would say the same thing from Tulsa, is that it's not necessarily where you're from, it's how are you going to be as part of, how can you feel as family? And so it has nothing to do with your location of where you come from. And so we would certainly welcome any applications from IMG and otherwise. So.
All right, great. If anyone else wants to add, otherwise I will move on to the next question. So I think this one was maybe about rainbow babies in general, but if there were any other programs I want to talk about this. So Erin, would you want to take it away with that question?
So 100%, I know Rainbow has a specific clinic devoted to this, so I don't want to take up their time, but I did want to note that Akron Children's, because of the way our clinics are scattered, you really do get to pick the areas that you are most interested in. So the particular clinic that I'm in works with medically complex children as well as refugee and a ton of foster kids. So we also have clinics that work mostly in Spanish, more suburban, more rural. So it's depending on whatever your interest is, that clinic does exist within the wider Akron Children's network. So that opportunity does exist in Akron.
Yes, and the question was,
sorry. Oh, sorry, Yuri.
Oh no, it's okay, go ahead.
Because we have the Child Abuse Fellowship, they also have their own clinic in which it's called Fostering Hope, and they see foster children. And in fact, children who have gone on to be placed into adoptions, the families tend to just stick with the Fostering Hope clinic. And through our child abuse rotation, we're able to work in that environment directly with the fellows and with the attending but you also can have the opportunity to work in that clinic more often.
Great. So anyone else, any other programs want to talk about caring for foster youth or medically complex children in your program?
I can try if my video is working. And this is Kira in Grand Rapids. So I have an interest in children with complexity. So that's an opportunity for us here is to rotate in the complex care setting. For a foster care standpoint, we do care for those in just our regular clinic, but our location is an intake center for refugees in West Michigan, so you get exposure to that intake care and primary care for refugees, so that's kind of a cool opportunity.
Great, thank you so much. So the next question, Addie, you took this question. I think a lot of it was answered in the chat, but if you don't mind just kind of putting it out there if anyone else wants to chime in.
Sure thing. I know I've been reading the chat too, so there's been lots of good comments about different procedure type things going on, so take a look at that too. But for the question, it says programs, what's your residence level of autonomy, and then also opportunities for hands-on experiences like procedures. So speaking specifically for U of L, as far as the procedures go, our intern year, we get a kind of blocked procedure rotation very early on, where we're learning any and every procedure that we as pediatricians, and especially general pediatricians, should know how to do. So IVs, LPs, central lines, intubations, learning about disaster medicine and what to do if a disaster here in Louisville were to happen, being able to go on transports and flight medicine kind of things too. And so it's a specific, it used to be 2 weeks, but I think it's a little spread out more now just based on our new X and Y schedule. But it definitely gives us the opportunity very early on to feel confident in our skills. I think I logged maybe 100 procedures over that kind of 2 week period because once you learn how to do everything, you carry the procedure phone.
I think we lost connection there, Addie.
And so anybody in the hospital, can you hear me now? Oh no. No, okay. So sorry, it's raining now, so with my internet it's a little weird, but just plenty of opportunities for procedures, especially to gain that confidence as an intern. And then for the autonomy standpoint, I have felt fully supported in kind of making lots of decisions on my own. There's always in-house emergency medicine physicians as well as PICU. So whenever we're on our night teams, taking care of our hospitalized patients already, we're the front line making a lot of those calls, but we always have a team that we can call on if we need help. And so I really think I've gained a lot of confidence in my skills in medical decision making, having that as well. And again, many of our attendings are super helpful too in complex patients. So I've definitely felt like I've had plenty of my own kind of power in making decisions, but also definitely have somebody that's there lending a helping hand.
All right, so we have about 1 minute here. If anyone else had anything to add besides what's been already in the chat. Otherwise, sorry, Laura, did you want to take away with that one question, the last question on our list?
Sure, real quick. I think mentorship is really important. That's a great question that you should be asking all programs on your interview days too. I think most places will give you an academic mentor, but at the same time, make sure you can find informal mentors and just be able to walk into people's offices and talk about their interests. Make sure that people are approachable, which I will echo, we are here at Akron Children's. I have many mentors depending on the topic or what I need to talk about, and have several people within the ICU as well as in nephrology and just in medical education. So that's a great question and really important.
Soon we'll start the resident after hours.
I guess a few things we can mention while we're waiting. All of the sessions have been recorded, and most of them have been uploaded to our new Future Peds Res YouTube channel. It happens to be the easiest way to get everybody on the same page with all the recordings, and they're being widely viewed. The numbers of views are just astounding. Like some of them have 300, 400 views already. So if you are interested in school